welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. Human immunodeficiency virus, acquired immune deficiency syndrome. Are you familiar with these terms? You probably know them more along with their acronyms, HIV and/or AIDS. For some time, there has been denial about the AIDS epidemic. It is a subject some people would rather just not discuss. In more recent years, though, efforts have been made to educate the young and old alike and encourage all to engage in open discussions about this disease. These efforts have had limited success. In part, people's lifestyles and customs are firmly entrenched within them, which makes it difficult to effect change. At a meeting of AIDS experts in Switzerland in May 2001, AIDS was declared the most devastating pandemic in human history. As such, it was recognized that by ignoring it, it was not just going to go away, so the dialogue needed to continue. In our efforts to support raising awareness and continuing the dialogue as it pertains to HIV and AIDS, we have with us today Ms. Eleanor Frederick, public health consultant and executive director and founder of the Antigua and Barbuda HIV/AIDS Network, or as we affectionately know it as ABHAN. So Eleanor, thank you very much for joining us, as mentioned on Healthy Perspectives. As we started off with the introduction, HIV/AIDS is something, we know it's there, it's in existence, but there's still this phase of denial. But as I always like to say, we first must understand to be understood. So let's understand what HIV and AIDS is. Can you give us a little background and explanation as to what these two are?
Okay, before I start, thank you so much for inviting me here this afternoon.
No, a pleasure.
I watch your program and really enjoy it, and very informative for the public. And so as we, within our capacity, try to get individuals to understand the disease, yes, it's an opportunity for me to do so now. HIV, human immunodeficiency virus, as you said earlier, it's a virus that when it infects the individual, and we'll talk about the modes of transmission later, it takes over the immune system. In that, the immune system no longer functions the way it should, because the cells that are there to protect the immune system are now being engulfed or taken over by HIV. They die. The cellular immunity, as they call it, is decreased, and the individual now goes from a point where the HIV, and I'll go back further to say that HIV, I think I really should say this, it's RNA virus. Within its capacity, it's a single-stranded RNA virus. It comes from a group called lentivirus, a genus called retrovirus. Now, in terms of lentivirus, as the name sort of implies, they are viruses that take they're slow in reacting, in that they take a very long time once infection takes place for them to react or to do what they plan to do. So which is why you see most individuals who are infected with HIV, they may not show the effects of that viral infection after they've passed, of course, the acute infection. They may not progress to the point of later on where it really takes over the body completely, because the virus moves so slowly.
So when we talk about infection, are we saying then that HIV and AIDS are the same thing, or are they two separate components?
No. HIV is a virus that causes infection. It goes in, it takes over the body, and the process of doing that and really, you'd say, affecting the immune system, the end result is AIDS. So AIDS now is, as you've said, it's acquired immunodeficiency syndrome. We focus on the word here, syndrome. Syndrome means it's a collective situation where different illnesses, different situations come into play that causes AIDS. So they're not the same, but one is a consequence. AIDS is the consequence of having the infection of HIV. The syndrome itself now is, as they would say most times, when someone has been infected and they either have just HIV and they come to the point of having any of those what they call opportunistic infections, and those are infections that are a result of having the immune system breaking down. So it's anything from toxoplasmosis to tuberculosis, herpes simplex virus, cryptococcus, as they call it, spiroides, and all the different types of infections that may come along, or cytomegalovirus also that comes along, that those involve the syndrome, then the individual now can be characterized as having AIDS, and also once the CD4 cells have dropped below 200.
So let's back up just a little bit as far as it pertains to the history. Do you have any insight as far as first cases and so forth here in Antigua and Barbuda?
Within Antigua and Barbuda, the first case was said to have been in 1985, and that's, of course, courtesy of Dr. Ramsey, who was was the initial, the first clinical care coordinator, and one of the individuals who started working with individuals way back then in 85. So he said it was in 1985, and then since then, of course, the number of cases have continued to increase. There have been a lull in between, but nonetheless, we still have the incidence of infection taking place.
And that's interesting because that wasn't too long after the first incidence of HIV/AIDS was actually recorded. That was back in, correct me if I'm wrong, in 81?
That was in 1981. 1981 was when they basically realized first that this particular situation was taking place where people were getting sick. Their CD4 counts were what we call inverted, in that instead of having the CD4 counts high, the CD8 cells were high, so the CD4 cells were dying. And initially, that's what they were looking at.
So you use the acronym CD4. Explain to our viewers exactly, if you could, what CD4 represents.
CD4 is a T cell. We have, red blood cells, we have white blood cells. Within the white blood cell category, we have the CD4 cells. CD4 cells are the cells that really, they're called helper cells, CD4 helper cells. And they really are the ones that when someone get an infection, any type of infection, they jump to the rescue. They take charge. They get rid of that, whatever it is, so the individual can get back to being healthy. Now with HIV, it just happens that those are the cells that HIV infect. And so as you'd imagine now, if it's going to be killing what's going to be helping, then you are having a problem.
Right.
And so that is why the immune system actually is completely eroded, and why individuals get very sick, because they're no longer able to, for their own body's defense mechanism is now compromised, and they're no longer able to defend or fend themselves off from infections.
So now let's clarify some of the modes of transmission then. This is obviously a serious disease, as we've highlighted so far. How is it then transmitted? How is HIV/AIDS transmitted from person to person?
Well, basically, I would say the four really major routes of transmission would be sexual. One of them is sexual intercourse, which means exchange of body fluids, male to female, female to female, male to male. Any kind of sexual activity that's going to involve body fluids is going to will lead to HIV if one of the partners is infected. And then, of course, you have mother-to-child transmission, or vertical transmission, is I think people prefer to be said, because what happens is they feel that too much of the blame or the emphasis is being placed on the mother when you say mother-to-child transmission.
Right.
And because in some cases, the mother didn't even know she's infected. She was infected by her partner, then she gets infected and have her child. So they prefer, politically more correct, vertical transmission. And so that's another method of, and it can occur during pregnancy, during delivery, after delivery when the child is being breastfed. That's another way of the infection occurring. And and of course we have the blood-to-blood transmission. Anywhere there is blood from an infected person to an uninfected person who also has either an open cut, bruises, whatever it is, that will allow the blood to enter their body. They can get infected in that way.
But why do you think there's such the fear of talking about it? If we understand how it's transmitted clearly, sexual intercourse, bodily fluids,
right,
vertical transmissions, as you mentioned, blood transfusions. I know in the...
And we must hasten to add that because over the years, the blood, in terms of blood transfusions, whether it be here in Antigua or globally, the blood supply is now very safe. I would say a few cases is going to be due to that because they have been screening the blood supply so well that that's not a mode of transmission. Not anymore. No, not anymore.
So again, why the fear? And when I say fear, I think anybody's afraid of the disease itself because of having an understanding of what it can do to the body, but the fear of individuals that have been infected with HIV.
So you want to know why the fear from those who are affected, or just the general populace?
The general populace.
I think it's because of the mode, one of the main modes, which is sexual transmission. That's my feeling. I think because individuals know that it's a sexual transmission, then they put a moral spin to the whole thing. They then say individuals who are infected may have gotten it because of their own fault, because they're promiscuous, because they have multiple partners, which some of that of course is true. I'm not going to say it's not, but I think especially in our society where the emphasis is so much on trying to, you'd say, the moral emphasis within our society is so strong that we then, anything that comes into play that's going to change that moral fabric, and HIV is one of those, because individuals are going to feel that because you got it, if you got it, and they're not certain how the person got it. All they know is that they have it, and they're going to assume that it's that way. But how about the baby who got it, as we said, through vertical transmission? How about the person who has an unfaithful partner? Yes, it's sexual transmission, but had no clue that this was happening. So there are many ways.
So I don't object to maintaining high moral standards. However, the fact is the healthcare provider who gets stuck by a dirty needle, as you said, the child that was born that way, it wasn't their fault. But there's still the fear of, almost afraid of, oh, I can't touch you because you have HIV.
And I think that now goes to education. I think if we're able to educate the public, just everybody, so they understand that HIV is not spread by casual contact. So if I touch you, shake your hand, hug you, spend some time in your house, just be around you, that will not, you have to engage in the activities I mentioned, or have the blood-to-blood contact, or mother-to-child, or vertical transmission. Those have to be the ways. It's not going to be through just that casual contact that you get HIV. And I think we're able to let them understand that they won't get it that way. And we're able to show them, a lot of times you want to have that evidence. And so you're able to show them, even in terms of individuals living in the same house over a long period of time, they don't get it. How about the doctors and the nurses who work with them every day? They don't get it. The only way you get the occupational injury or transmission is when there is either a needle stick or some other means of blood-to-blood contact. That's the only way it really happens in the occupational setting.
So when it comes to being HIV positive, can't a person be HIV positive and AIDS free?
Definitely. Individuals right now, with the way the medications are being given, and if individuals are able to really adhere to the medication regimen, they can stay HIV free maybe forever until they die. And of course the life expectancy, as you know, has increased because as individuals take their medication, adhere to it, stay healthy, they don't have to get to that AIDS diagnosis. The AIDS diagnosis comes along when the person, the CD4 cell, the numbers drop below 200 or 200 and below. So if they're able to keep their CD4 counts high, don't have the other opportunities of infections, they will never get to the AIDS diagnosis.
And can live.
And can live just a normal lifespan like everybody else. Go to work, take care of their children, be productive, yes.
Okay. This is a good point for us to pause for just a moment. We're going to take a quick break and come right back to you. So thank you for joining us, tuning in again with Healthy Perspectives. We have with us Eleanor Frederick, again, founder, director, executive director of Antigua and Barbuda HIV/AIDS Network and public health consultant. Eleanor, we were talking about the fears that individuals have with regards HIV and AIDS, but can you walk us through the progression, the disease progression? A person is infected with HIV, then what happens?
Basically, the infection itself, from any of the modes of transmission that we mentioned, takes place. Then the individual goes through what they call an acute phase. The acute phase is when the body now is reacting to this new, this virus within it. And the CD4 cells and other cells, macrophages, etc., are going to work, and they're all trying to defend the body. At this point, when the person is just newly infected, is when the number of viral particles are the highest, and the person is actually most infectious. The most infectious because here it is now, the replication is taking place like crazy. The viral particles are high, and the person is infectious yet, and the person may go through also a phase of having fever, malaise, not feeling well. Some people don't even know they're infected. Mm-hmm. They will tell you that they didn't feel anything, nothing happened strange, didn't even have the flu-like symptoms, nothing. They just got infected and it went on. But however, their body is aware of something happened. And so they're in that phase now of when the virus is really very high. And they're most infectious, like I said. And then that will go for a couple of weeks and it will subside. And then it may just, nothing will be taking place. So if they did not catch that initial phase, that acute phase as they call it, they may never even realize that they were infected, which is why many people will not be aware they're infected, and which is why it's so important for testing to take place, especially if individuals are involved, yes, in risky behavior and have multiple partners and are exposed, to any situation where they think they may be infected. So they go to that initial phase and they get over that initial phase. Like I said,
they're now in this sort of,
and then they're not, yes, nothing is happening, nothing happening, and they have no idea unless they're one of those individuals whose body reacted in such a way that they say, gosh, I'm feeling sick, what's happening? I got a fever, etc. Otherwise, they just go right on. And then that phase of nothing happening can last anywhere from 5 to 10 years, where they are quite unaware and they're going about their business, and they now are in a stage where they now can be passing on the infection to someone else, because not only are they unaware they're infected, but they are infected, and the virus is in their system, and the virus is being passed to their sexual contacts. And so they go through that phase, 5, 10 years, sometimes even longer, depending on the individual's immune system makeup.
And I'm listening to you, and we talked about the progress of it, got an understanding of the disease and the disease process. We're calling these names CD4, T cells, and things like that, and we talk about education. Your average individual is not going to know what that is. The infected person may not fully understand what that is. We can say educate, but it's almost like the person needs to be a physician or a healthcare provider to fully understand. Do you think that is a part of where the problem is? It's a complex disease, it's a complex illness?
That could be one of the barriers, yes, I agree, because many times, even if you want to break it down, really simple, the simplicity may not still bring to fore to the person what you're trying to say. You're going to say, okay, it's your blood cells, and just think of it that it's like being at war, and you have these soldiers from the enemy comes in, and the enemy soldiers come in and take over your fort or your place, and then they infiltrate it, they take it over, they sort of knock you out, so to speak. So you're not quite there, you're halfway there, or you half of your infantry is down, and the other half is working, and so you're not in a capacity to defend yourself. And then with that taking place, and the enemy soldiers have taken over, you are constantly at a disadvantage to protect yourself, because your fort, I'm going from the body now to your fort, your fort has been taken over by this enemy, and the enemy does not stop. Just think of it, you have this enemy that is not saying, okay, we're going to rest and take it easy. This enemy keeps going and keep fighting and keep attacking your system. And no matter what you do, it's there. You sleep, it's there. You get up, it's there. You decide you're not taking your meds, it's still there. Okay, you say you're going to forget about it, go into denial, not happening, all these things you say to yourself, but it's still there. And all the time it's getting stronger. And that's the bad part about it, because it doesn't retreat. It only gets stronger, and it can get into the billions of copies in one person. And so it takes over your system. So that's the only thing I could say. The only way I could say to make it simple. Sometimes not making simple doesn't make sense to me either, because I'm so used to talking in the medical terms or in the scientific terms that I'm trying to get back to say, okay, what was I saying there? But seriously, that's the only way I can say. You got to think of it as that.
What do we use then, or what is used to fight the enemy?
Okay, so in that case now, so you have this enemy, you're at war, and it's not guns anymore, it's not the other things that they use in actual war, it's the medication. And so we went from way back in 87, I think, with AZT.
Right.
And AZT was the very first antiretroviral medicine that came on board, and that was as we call monotherapy. So it was just one medication being used to fight it. Very effective, but it turns out that as the virus continues to grow and to multiply within the person and to cause resistance, which it always does eventually, the monotherapy that they found was not good enough. It could not keep that virus at bay.
So what are we using now? So
we're up to the point now we're at HAART, highly active antiretroviral therapy, HAART. And so HAART now is a combination of a number of medications. So the individual may have one tablet or 2, 3 pills, but what's happening now in that situation is instead of just one medicine being there, it may contain as many as 3. And so if this person may be treated with 3 or 4 different medications all at the same time. Why it's effective is because the virus itself doesn't just attack one place and stop. Once it tries to enter the cell, it's the viral particle. It's coming into the CD4 cells, I say the T cell. Okay? So the viral particle comes in. It goes through a process of attachment. So to attach, it has to get onto what they call the co-receptor. You must have co-receptor binding, otherwise it will not be able to fuse. Then you have the co-receptor binding, it fuses, it enters. Okay? Once it enters, so that's right there as I'm talking about the attachment and the entry. That's one stage where the antiretroviral medicine can work.
What does it do?
It basically will stop the entry in that you have one called fusion, and there's another one, I think, Zentry. Those are 2 of the entry inhibitors, and they prevent the virus from attaching to the co-receptor. You have 2 different co-receptors. One is called CCR5 and CXCR4. So if you can prevent that attachment to the co-receptor, can't enter.
So since the enemy is constantly multiplying,
yes,
and it's as aggressive as it is,
yes,
taking these medications then means you've got to be on point then, I presume?
Yes.
How so? Does that mean I can take it once a week, twice a week?
It has to be taken as prescribed, and for each person it may be different. So you may get 1 tablet once a day, somebody may have 3 pills 2 times a day, or differently, and they also sometimes may be taking medicines for the opportunistic infections I mentioned, the TB, other things, CMV, toxoplasmosis. But they must take it as prescribed at the prescribed, once they've decided with their healthcare provider what is best for them. So they're going to say, okay, you're taking 2 pills twice a day. You work something out. Okay, so I take it at breakfast, I take it at 7 in the morning, I take it in the evening with dinner, 7 o'clock. You can't then decide, okay, today or next week or whenever I want to, I'll just change it from 7 o'clock to 10 o'clock. And then I will take the other one when I feel like some other time. It's very important, and that's where head adherence comes in. It's very important that they take it as much as possible at the prescribed time, with or without meals, depending on what's prescribed by the pharmacist and the healthcare provider. They must follow as closely as possible.
So a person can't then lead a fairly normal life or active life because they're tied to the medication?
They're not really tied to the medication, no. I think it's such that they're able to make decisions and plan around it. And I've seen where individuals, once they know what they're dealing with, the enemy they're dealing with, and that is, it's relentless, it's going to be coming at them, and they may, some of them may even experience the fact that they had cut back last time and then they miss a dosage, or I miss a week, or whatever they want to miss, and they feel the result. Then they get on target and they stay within it. And once I think they develop, it's just like taking vitamins, right? You try to take your vitamins with breakfast, with your meal, or you take it in the evening. Everybody depends on what's good for you. Some people can't take it in the nights. Some people can't take it in the morning. So you develop a regimen that's best for you, but you stick with it. Because if you're going to take the medication and you're not going to feel so great, then you're going to say, okay, and it's only one, you say, I'll take it in the evening. Other people, some other persons who are taking it have no side effects, no nothing. They take it, they move on with their regular life, and they feel better than another person who is not even on medication.
What can a person then do also to help support this routine now? And when I say support, as far as their own lives, to make sure that they remain healthy, because the minute you become ill with anything, that means your body's going to start to go down. What are some of the things that are in these individuals that are HIV positive encouraged to do with their lives?
Well, basically, the individuals who are HIV positive, they are encouraged not only once they're tested and diagnosed, with a confirmatory test that they're indeed positive, they're basically encouraged to get into care and treatment and also support, which means they get to the healthcare provider, they get to the clinical care provider, they get their medications, they keep regular visits, and then they get the support that they may need. And for each person it's different. And so one person may need the support of what we call in our organization a buddy. So we have a buddy program, and we also have a peer program. So we call it Peer Buddy Treatment Adherence Program. And basically what we try to do is pair the individuals with a buddy or with a pair individual. That means somebody who's also treatment adherent and who will then be able to guide them in terms of keeping on their medication regimen.
Well, I understand obviously that the need for the healthcare providers and so forth, it's crucial for their survival. But you say support and needing the external support. Do you find, or why do you find that that's such a problem? Is it because of the stigmas and so forth attached to the disease itself? Why would they need a buddy?
It's everything. It's everything, because take into consideration that I know for sure here in Antigua, and I think globally most times, individuals who are infected with HIV are the individuals who are many times most likely in need of other support mechanisms. And it means that they may have lost their jobs due to the disease, before the disease or after. Not necessarily caused by it, but one of the things that may happen is that they may find themselves unemployed because they're sick. Now, of course, it's not happening so much now because people are staying healthier because they're taking the medicines, but that's one of the things that can happen.
Okay, we're going to pause there for another moment. We'll take another break and come right back to you. On the medical front, scientists have learned much about HIV and AIDS and have developed some highly effective but costly drugs that have prolonged the lives of many persons. Dr. Sharon Newland, a surgeon, was once quoted as saying, "The amount of information that has been gathered about the human immunodeficiency virus and the progress made in mounting a defense against its onslaught are nothing less than an astonishment." But despite all the research and all the progress that has been made, we are still dealing with, as one UN diplomat, Stephen Lewis, put it, a modern-day apocalypse as it pertains to AIDS. Interestingly enough, in spite of all the research efforts and all the information published, AIDS continues to march on with infections mounting at an alarming rate. So we ask you to remember this. AIDS differs from many other epidemics in one important respect. It's preventable. So educate yourself and be prepared to adhere to certain principles and guidelines about blood and body fluids, while also making adjustments in sexual practices. By so doing, you can, in many, if not all cases, avoid contaminations. Persons not affected by HIV, you too are asked to educate yourself. Know that HIV is not spread by casual contact, so you don't have to be afraid of sharing a telephone, a bathroom, or even a meal with an individual that may be HIV positive. The love and affection that you withhold from a friend or family member that is HIV positive may very well be a contributing factor to their early demise. Take care of yourselves. We thank you for spending time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda. May your perspective always be a healthy one.
Join us next week Monday on June 17th at 8 p.m. as we speak more on sickle cell awareness, followed up by Part 2 on HIV on Monday, June 24th. Healthy Perspectives, an AUA ABS initiative offering you a positive view on health.